On Friday, August 8, 2025, tragedy struck the heart of America's public health system in Atlanta, Georgia. What began as an ordinary summer morning quickly turned into a day that would be etched into the nation's memory forever. The city awoke to the promise of a typical day, but within hours everything changed. The main campus of the Centers for Disease Control and Prevention, a global symbol of health and safety, became the site of shocking violence. Sirens echoed through the streets as first responders rushed to the scene, and the world watched in disbelief as live news feeds captured the chaos unfolding at one of the most secure institutions in the country. The sense of security was shattered instantly, leaving a community and nation reeling. Employees, many of whom had dedicated their lives to protecting others, suddenly found themselves in the midst of unimaginable danger. Families anxiously awaited word from loved ones, while neighbors and colleagues tried to make sense of the horror. The attack was not just on buildings, but on the very mission of the CDC and its dedicated staff. The violence struck at the core of an institution built on hope, science and service, leaving deep scars on those who witnessed it firsthand. News spread rapidly and disbelief settled over the country as people struggled to comprehend the event. Across the nation, televisions and phones lit up with breaking news, and social media was flooded with messages of shock, support and sorrow. Even places of healing and science, it became clear, are not immune to violence. The attack served as a stark reminder that no place, no matter how vital or revered, is completely safe from tragedy. The tragedy forced a national conversation about the safety of public institutions and those who serve within them. Leaders and citizens alike began to question how such an event could happen and what could be done to prevent future tragedies. As the sun set on that Friday, Atlanta mourned, and the CDC began the long process of healing. The city came together in grief but also in solidarity, determined to support those affected and to honor the lives forever changed. The story of that day is one of loss, but also of resilience and the enduring strength of the human spirit. In the face of tragedy, the Atlanta community and the nation stood together, vowing to remember, to heal, and to move forward with hope. The calm of a Friday afternoon was shattered at 4:50 p.m., just as most employees were preparing to wrap up their week and head home. The CDC campus, usually a symbol of safety and scientific progress, was about to become the center of a national tragedy. Without warning, a lone gunman began an assault near the CDC's main entrance, catching everyone off guard. The sound of gunfire echoed through the corridors, sending staff and visitors scrambling for cover. Armed with multiple firearms, he opened fire indiscriminately, striking several buildings, including the offices of the agency's top leaders. Windows shattered, alarms blared, and chaos erupted as people tried desperately to find safety. Law enforcement had received a warning from the gunman's father earlier that day, who reported his son was suicidal and potentially dangerous. Despite the alert, the attack unfolded with terrifying speed, leaving little time to react. Investigators later revealed the shooter believed he was harmed by the COVID-19 vaccine, targeting the CDC out of personal grievance fueled by misinformation and conspiracy theories. This tragic misunderstanding drove him to violence, highlighting the dangerous consequences of misinformation in our society. The attack's chaos spilled into a nearby CVS, where terrified customers and employees found themselves in the crossfire. The confrontation ended with the shooter found dead inside the store, bringing a grim close to the rampage. It remains unclear if his fatal wound was self-inflicted or the result of police gunfire. The uncertainty only deepened the sense of shock and confusion that gripped the city. A massive police response quickly secured the area, locking down the campus and surrounding neighborhoods for hours. Streets were blocked, helicopters circled overhead, and families anxiously awaited news of their loved ones. CDC employees, suddenly thrust into a terrifying lockdown, received the urgent alert: run, hide, fight. Many barricaded themselves in offices, texting family and colleagues as they waited for the all-clear. The sense of violation was immense, as a place dedicated to saving lives faced a direct and violent threat. The emotional toll on staff and the community was immediate and profound. The aftermath left a community forever changed, grappling with grief, fear, and the difficult questions that follow such senseless violence. Amid the chaos, stories of bravery emerged. none more so than Officer David Rose of the DeKalb County Police. At just 33, Officer Rose ran toward danger to protect others, confronting the gunman and putting his life on the line. Tragically, he was shot and later died at Emory University Hospital. He leaves behind a pregnant wife and 2 young children, his loss deeply felt by family, colleagues, and the Atlanta community. Officer Rose was hailed as a hero, his actions saving lives and embodying the highest ideals of law enforcement. His sacrifice is a stark reminder of the risks officers face every day. As we remember that day, we honor Officer Rose's courage and commitment. In the darkest moments, he stood as a beacon of strength. His legacy will live on in the community he served. While the attack brought tragedy and fear to the CDC campus, there was immense relief that no CDC employees or civilians were physically harmed by gunfire. The quick response of security and law enforcement prevented what could have been a far worse outcome, and for that, the entire community was grateful. Still, the emotional toll was immense. Several people were hospitalized for stress and anxiety. The shock of the incident rippled through the staff, their families, and the wider community, leaving many struggling to process what had happened. The presence of 92 children in the on-site daycare made the situation even more harrowing. For parents and staff alike, the thought of children being so close to danger was almost unbearable. Daycare staff acted swiftly, following emergency procedures to keep the children safe and calm. Their training and composure under pressure made all the difference as they ushered children to safety and comforted them during the lockdown. Parents endured agonizing hours before being reunited with their children, a moment of overwhelming relief. Many described the wait as the longest of their lives, filled with fear and uncertainty. Mayor Andre Dickens confirmed all children were safe, a collective sigh of relief for the community. His words brought comfort, but also underscored the seriousness of what had occurred. The bravery and preparedness of the daycare staff were crucial in protecting the innocent. Their actions not only ensured physical safety, but also provided emotional reassurance to frightened children. The trauma of lockdown and violence will linger for staff and children alike. Even after the immediate danger passed, the emotional scars remained, with many needing time and support to heal. CDC leadership recognized the need for emotional recovery, not just physical security. They began organizing counseling sessions and support groups to help everyone process the traumatic experience. Protecting the innocent means helping them heal from invisible wounds. The path to recovery will be long, but with compassion and support, the CDC community is determined to move forward together. In the face of crisis, CDC leadership and Atlanta officials responded swiftly and decisively. New Director Susan Monarez, just a week into her role, prioritized staff safety and coordinated closely with law enforcement. Multiple agencies, including the FBI and Georgia Bureau of Investigation, worked together to contain the threat and secure the campus. Mayor Andre Dickens provided timely updates and reassured the public, especially about the safety of the children. Leadership shifted quickly from emergency response to supporting the CDC community. Employees were allowed to work remotely, and counseling services were made available immediately. These compassionate actions set the tone for recovery and healing. The swift, coordinated response was critical in managing the crisis and beginning the path forward. The shooting occurred as the CDC faced immense challenges: politicization, public skepticism, and deep budget cuts. The agency had lost nearly a quarter of its staff in recent layoffs, leaving morale low and resources stretched thin. The attack, seemingly motivated by vaccine grievances, was a violent symptom of growing hostility toward public health institutions. Proposed federal budget cuts threatened to halve CDC funding, impacting every aspect of its mission. Ironically, divisions focused on gun violence prevention had recently faced reductions. The tragedy underscored how political rhetoric and disinvestment can have real-world, even deadly, consequences. The CDC was being asked to do more with less, all while navigating a climate of public hostility. The attack was not isolated. It reflected deeper problems facing a vital American institution. News of the CDC shooting sent shockwaves nationwide, prompting grief and support from leaders and citizens alike. Officials from both parties condemned the violence and praised the heroism of Officer Rose. Health and law enforcement leaders, including HHS Secretary Kennedy and FBI Director Patel, expressed solidarity and called for a thorough investigation. The public responded with messages of support for CDC employees, recognizing their ongoing challenges. The tragedy reignited debates about gun control, mental health, and the impact of political rhetoric. Advocates linked the attack to recent cuts in violence prevention programs, urging renewed investment in public health. The incident became a powerful example of the urgent need for action on violence prevention. In the aftermath, the CDC and Atlanta community focused on healing. Leadership allowed remote work and provided immediate access to counseling services for staff and families. The psychological impact was profound, and professional support became a lifeline. The Atlanta community showed solidarity with memorials and messages of hope. These gestures reminded CDC employees they were not alone in their grief. Rebuilding trust and safety will take time, but the foundation of support is strong. Healing will require ongoing care, resilience, and unity. As the shock fades, the focus must turn to the future and prevention. The CDC shooting is a call to action, demanding real change, not just words. We must address mental health, misinformation, and access to deadly weapons. The resilience of CDC staff will be key to recovery. Their dedication inspires us all. Preventing future tragedies requires unified effort, law enforcement, mental health professionals, lawmakers, and communities working together. We must challenge rhetoric that demonizes science and support those in crisis. Advocating for common-sense policies can help reduce violence. Out of tragedy, there is an opportunity for unity and positive change. Let us honor the work of the CDC and the sacrifice of Officer Rose by committing to a safer, healthier future. May this moment inspire us to ensure places of healing and science are never again scenes of violence.